Hello and welcome back to another edition of GNAT-TV's In-Depth series. I'm Andrew McKeever, the news director at GNAT-TV's News Project. It's a pleasure to have you with us today on Thursday, September 1st. Our topic today is mental health and how we're all doing during a moment in history that I'm quite sure is going to be analyzed and written about for quite a while, well into the future. We've all been hearing a lot of about concerns about how the pressures brought on by the COVID pandemic and other events that we're working through currently have increased some of the psychological pressures on many of folks living here in our area and around the entire country. We're really pleased today to be joined by three folks from the United Counseling Service who are here to talk about that and give us some insight into how things are going. Really pleased to have with us today in our virtual studio, Lori Vatican, who is the Director of Outpatient Mental Health and Substance Abuse Services at the United Counseling Service. Alex Figueroa is the Assistant Director and Substance Abuse Disorder Manager. And Alia Reeve is the Medical Director at UCS. I'm sure many of you already are familiar with the United Counseling Service, but it is a nonprofit social services and mental health center which has been serving the Bennington County area since 1958, currently serving about 3,000 local residents. It operates a variety of services, including Head Start, as well as psychiatric and family outreach programs, too numerous for me to mention here, but you can find them all on their website at ucsvt.org. They have offices in Manchester, as well as their main headquarters down in Bennington. So, folks, Lori, Alex, Alia, thank you again very much for making the time to be with us today. I really appreciate that. It's a very important topic that, as I said, has been getting a fair amount of attention. But Lori, let me start with you, and we'll go around our Zoom room here, and I guess give us a sense as to how severe, in your opinion, is the mental health crisis that we've heard a lot about playing out locally, and I guess what's the comparison like to perhaps other points in the past? Is it much worse, or a little bit worse, or kind of about the same?
Well, Andrew, I don't think there can really be a comparison to post-pandemic, right? I mean, it's pretty obvious that it's severe, and that includes unfortunately, substance use disorder that we're seeing as well. And we've never really seen anything quite like this. There's unfortunately, a lot of violence, even gun violence in our county. There is political unrest, and people are more isolated than ever. And I think that they feel disconnected from one another. And I think about our youth. So many of the skills that our youth are able to develop are through social engagement in schools. And so I wonder what our future will look like, especially for young people.
Okay. Well, Alex, let me go over to you. What's your take on the situation, what you're seeing in the course of your work at UCS?
Yeah, I mean, to piggyback off what Lori was saying, I think the one thing that it's worth mentioning, especially in a community like ours, right, we're rural Vermont, isolation is huge, especially in when a pandemic, nonetheless, right, where very isolation has been, I think, one of the key factors that has contributed to the increase in mental health and of course substance use disorders. And so, it most certainly, in my mind, where I sit, especially from that substance use disorder side of things, it plays a huge role. Isolation, engagement with friends and family, and obviously we've come out a little bit of the pandemic, but I still think we're still seeing remnants of that.
Yeah, I would say even more than remnants. I think it's very much we're in the midst of it. We saw a huge increase in both depression and anxiety disorders, comorbid with substance use disorders. And it's reflected in having a steady rate of people attempting or completing suicide, and that travels together. What you're talking about, Lori touched on, was also the disconnect for people who are isolated, and that sense of not being seen and perceived by others and validated makes it more difficult to reach out, makes it more difficult to trust that there will be people listening, makes it more difficult for them to make use of the social supports that sustain us through difficult times. One of the things that helps us to do our work, and you see reflected by having the three of us here on this video team, is that we work in collaboration with each other. This is really difficult work to do, to support people and to bring them through really challenging times without supports for ourselves, because this is a time where, as therapists or therapeutic community, we're supporting people through a difficult time that we too are experiencing. So that every time you deal with somebody who is feeling particularly overwhelmed, it is touching on the parts of you that feel overwhelmed also. So we are always treating on multiple levels at the same time.
A couple of you mentioned isolation and lack of engagement. I guess I'm just wondering, that certainly, I'm sure, was a gigantic problem in the first year or so of the pandemic, 2020, into early 2021. Is that still a case where there are a lot of people who are kind of, are you feeling isolated or cut off from friends, family, schools, jobs, social activities? Is that still as bad as it was, let's say, a year or so ago?
I think that is not overtly all as bad 100%, but it is like going, a person going to war and surviving the war, and the worst of their traumatic experiences is most troubling a year or two or three later.
Yes.
So in the time of the emergency and everything shut down, there was a percentage of people who struggled very, very deeply and severely, but many people just got by and shut down. Now that more things are opening, there are more possibilities, it becomes more complicated. And yes, you can go out, but we are still not without our masks. We are wearing them. We are unmasked to do a video in our own office. But as a healthcare provider, we are masking around people all the time. When I go and consult at the hospital, I'm following protocols for keeping safety and reducing infectious disease spread. So it is always in our mind every day, all the time. And in that sense, it is not back. It'll never be back in that sense to 2015. In the same way that for many people after Hurricane Irene, the literal landscape of Vermont changed. And you go forward, you don't go back.
Right. Well, okay. Do you and let me ask all of you here, do you feel that the situation is, worse here in Bennington County, or about the same across the entire state? And again, Lori, let me start off with you. Are you seeing the numbers that you're looking at, the data you see? Is it similar to elsewhere in the state, or worse here?
Well, I think two things. I think that it's less stigmatizing to get help. So we've done a great job. UCS has done a great job in saying, hey, we're here for you and it's okay to talk about it. So I think that we're seeing more people for sure. But at the same time, there is a concern around the co-occurring issue of substance use disorder and all that comes with that, right? So we are seeing more violence. We're seeing more homelessness. We're seeing people have less ability to cope because of this. And so families are usually impacted. So, and as Alia said earlier, we are seeing an increase in anxiety, PTSD, depression. So those are very real. And at the same time, people are reaching out, which is wonderful. And that is the message that you do not have to be alone, that we are here for you. And UCS has been great in creating programming to meet the needs of our community. And that is an ongoing conversation. And Alia and Alex are wonderful at, bringing anything to my attention where there might be a deficit, like we've got to get on this. So I feel like, yes, it's true. We do have increase in mental health and substance use concerns, but we are really trying hard to meet the needs of our community.
And to add to that, I think to put it in like numbers perspective, when we looked at, when COVID hit, we've seen a huge jump of folks looking to tap into services, whether it's not just mental health, but substance use disorder services, right? And so those numbers have grown. And to Laura's point, we've had to become very strategic and innovative to be able to meet that demand in providing those services. And I know, one of the key innovation, I'll let Lori speak on it, because I really know it was definitely multiple leaders within our organization that created what we called FAST, right? Find access to services and treatment. And the point of FAST is to really, that enhanced same-day access, meet the need of the community where folks are, they need support and they need help. And this was a really cool, innovative way to meet the demands and get folks connected.
Let me just stick with the question of substance use for a second here, because that was a big problem here and elsewhere around the state and around the country, for that matter, before the pandemic. We were having this conversation in 2019. We'd probably be talking a lot about opioids and overdoses and stuff like that, and we still can for sure. But I guess I'm just wondering, how have you seen that play out over the last couple of years? I mean, that seemed to kind of the pandemic seemed to kind of overwhelm that, and we sort of lost our attention on the opioid issue and substance use disorders. But I'm assuming kind of maybe on background, maybe not so much on background, that was still going on, and a lot of folks were probably responding to the pandemic and the pressures of the pandemic by abusing substances. Am I correct? Alia, I see you nodding your head, so I'll go to you.
Absolutely, but I'll let Lori speak to some of the numbers. But absolutely, that went on both behind closed doors and in backyards. And then what is scary about it being so accessible is it's also accessible to older people, and it's accessible to young people. And with the financial insecurity of losing jobs, there's a problem of people having to go to other sources to get adequate pain medication, and then they can get to unregulated medications, which then can lead to inadvertent overdoses and deaths. So there's a really complicated web of mix of socioeconomic opportunities, age, network of social supports, who you know, where you've been, who triggers you, who is mean to you, who bullies, who do you not feel safe talking about, what is the level of intergenerational physical, sexual, emotional trauma that is in the household that overlaps with a final common problem called substance use and overdose. And I didn't want to steal all your thunder, but I think it all goes together, Lori.
You know what? It was beautifully said. And I think really what it does is it takes a capable person and it makes them incapable. And that's the saddest part about this disease. And it does affect the whole family. And the thing is that, people are self-medicating, right? So they're feeling this increased anxiety, this increased depression. And like Alia said, it's so accessible. And unfortunately, it's the substances that are available and they're affordable are what's killing people. And so it's this horrible kind of experience that we're having in this across the nation. And I think it is connected to crime. It is connected to, youth becoming addicted very quickly, getting guns because that's how they can pay for their habit. Unfortunately, people are being brought in and we have human trafficked children in our community. And this is, it's bringing a host of issues that are devastating. And it is truly, as our US, Surgeon General said, that this is devastating, the mental health crisis that we're in. And this is part of it, and it's far reaching. And it's really a responsibility for us to be able to help parents and professionals to notice when someone's being human trafficked, to know what it looks like when someone is impaired, and the various ways that they're impaired by the substance they're ingesting. And so I think, it really is calling us to become smarter and more attuned to our community, and help, not enable, but help our professionals respond in a different way.
The really cool thing is, by it becoming more overt, there's an opportunity for interventions to be more successful, not hiding it away as just a breaking of laws and punishing, but really looking at how people can make changes and how they can learn and relearn and re-experience the meaningfulness of being in genuine connection with people. So for all of the doom and gloom that we have to present for you, for an audience, when we have to justify to granting agencies what we do, there's a lot of hope. And these are not irreversible conditions. These are not end stage diseases in and of themselves. And so there's a lot to be done. A lot of it is not medical. A lot of it is not even necessarily professional psychological. It's the professional psychological piece is the tool by which we engage people to be able to sustain the habits that they need to live a full and complete life.
Alex, I think I cut you off there a moment ago, so let me get back to you here real quickly and bring you into this one.
Yeah, Andrew, I think we can all agree this is a very complex world or topic that that we're discussing, because I think there's so many components to it, right? And I think of social determinants of health, where people live, eat, sleep, where they receive health care, socioeconomic status, right? That also contributes to a lot of this increased mental health and substance use disorders. As it relates to the kind of overdoses and impact, I want to kind of touch on one thing, because I do think it's important. Substances, it's not just opioids, right? It's really, fentanyl has really kind of been a key factor. But really, we're starting to see an increase in stimulant-related overdoses combined with fentanyl. So, for example, cocaine and fentanyl, or cocaine and opioids, right? Methamphetamines and opioids. So there's a lot in data. The Vermont Department of Health's Division of Substance Use Programs provide great resources on data relating to overdose fatalities, and it does a great job. They do a great job of really breaking down overdoses by substances, right? So, the data, and you can look at data from 2010 all the way up to 2022. And so there's most certainly trends. And COVID-19 really exacerbated
and aggravated.
Thank you. Increase and the numbers speak for itself. I also want to make a point, because it's something that it's not talked about enough, is the increase in alcohol use. And you can find this online, that just increase in alcohol sales, right? I think of individuals that have an alcohol use disorder. That's like that secret pandemic that no one's talking about. And obviously we see a lot of discussion on opioid use disorder and overdoses and all things along that lines, but alcohol plays and also contributes to a lot of what we're discussing now. So I just wanted to tune in and throw those key points out there as well.
Well, let me just shift gears back a little bit to, I guess, some of the psychological traumas that you're seeing people go through that aren't necessarily related to opioids and not abusing substances, whether it's alcohol, cocaine, fentanyl, whatever, and just sort of look at sort of the other issues that folks are coping with, perhaps grew out of the isolation that we were talking about at the start here. Um, and maybe an interesting starting point for this might be to kind of break it down by age brackets. Let's start with young folks. Again, I've been hearing a lot that younger individuals, school age folks, people in high school, junior high, middle school, have really been struggling a lot with the 2 years or so we've seen through the pandemic. Have you been seeing an uptick in folks coming to you or being referred to you for help from that age bracket?
For sure. So we're hearing that they're feeling like they're falling behind in school. They're definitely feeling a sense of they've lost out. These are years they can't have back. So, and we're observing their social skills are, these are the imperative years where they're developed. And so without that, we're noticing maybe some awkwardness around social engagement. So yeah, we are absolutely seeing that there's a different child, and they are more anxious and less able to connect with their peer groups. And so those are the observations that we've made. I don't know if Alia or Alex, if you would add to that.
Alex, did you want to go?
Yeah, it's interesting. I had a conversation with my sister prior to this meeting. This was actually yesterday. She will be 16 in September. Recently moved her from New York to Vermont, and so she started school at MAU. And we had the conversation was around her own experience. When the pandemic hit and how that affected her. And one of the things that she had said was obviously with the decrease in social engagement, it impacted her significantly. She's at a point now where she does feel a little awkward when it comes to trying to, as simple as engaging in a conversation. There's a sense that she's feeling, whether it might be judged or, so it struck me because someone who I would say is very engaged, likes to be involved, because of the pandemic, it put her in this routine where she again was behind a computer screen, behind closed doors, not engaging with other students. I mean, there's a difference, and we see this when we provide treatment here. There's a difference when you're providing telehealth than in person. The lack of engagement, when we're looking at the kind of their growth or improvement within their treatment, they're most certainly, you can see the differences between that face to face versus the telehealth. And so I use that as kind of a personal example because it's something we had talked about, but we most certainly see the same things with a lot of our young kids as well.
And referrals to the psychiatric treatment team have increased in complexity from very young age through teenagers. And universally, anxiety is a component of the presenting symptoms. They don't always meet criteria for an anxiety disorder, but one of the complaints is feeling anxious. And I would have said 10 years ago, that was not the universal complaint.
I guess then let's go on. Then, are you seeing the same issues playing out in the older demographic groups, folks in middle age or senior citizens? Is it the same kinds of trauma, or is it a different kind of complexity involved in that?
Well, that's been closer to my heart because I am aware that they're less able to use digital communication. So when the pandemic hit, part of UCS's response is we delivered telehealth communication to anyone that needed it. We just, I was delivering it. We all were going to homes and deliver them so that people could have their sessions and feel connected. But we were not hearing from elderly, and that was very worrisome for me because I don't think it was accessible, and I'm not certain they knew that they could do phone sessions. And so it was very concerning. I mean, I remember trying to ask people, please check your neighbors. I myself was checking on elderly neighbors, and they in fact were afraid. They were afraid to go to the supermarket. A lot of them kept the TV on, and I think that in itself was traumatic to hear the numbers go up. So I think they were not able to get their basic needs met even. So it was very worrisome, and this particular group was on my heart the whole pandemic.
All right, Alia, did you want to add anything further to that?
I think that's a very apt description. There is no age group that managed to skip being affected by COVID-19 pandemic. And while there were groups within that were more severely impacted, such as first responders, such as many of our staff who were directly encountering people and dealing with the risk of infection, who are working with people 24/7. And there are many people who were losing people at distance. So not just in this state, but have relatives across the United States and the world, and losing them to the COVID-19 deaths. That was a huge traumatic experience, compounded by the awareness of the global impact all the time. So it was not just losing your family member, it was you losing your family member along with another million people in that country. And so these are the echoes that we're feeling and hearing about now. And so we see anxiety presents in different ways. Alex mentioned the increased use of alcohol, and we see that in the people that we interview for psychiatric evaluations, that there are more who they have not quite met criteria for a substance use disorder, but their habit has increased. So where before they had a glass of wine once a week, they'll now be having it 4 to 7 times a week. So that patterns changed. They're struggling now to re-engage in group activities. On the one hand, they want to. On the other hand, they're still in that, oh my gosh, you can't go in with other people. You have to do everything by yourself. But with all of the stores open, with public spaces opening, the reality is that we are doing group things. We are going in the same spaces. And so it's this cognitive disconnect and retained fear that is a little bit at war in people all the time. And that then gets compounded. So people who have psychotic disorders, it works its way into their paranoid thinking. People who have a tendency for depression, it leads and exacerbates their hopelessness and their sense that even though they're taking their medication, nothing is changing. So they feel helpless to make it different. So these are the components that are continuing to feed some of this sense of lack of empowerment.
And Alex, before we move on, anything further you wanted to add to that?
No, I mean, Alia and Lori, I mean, hit the nail on the head. I mean, very well said. I echo every piece of that discussion.
So I find myself thinking then, what are some of the solutions then for this? If someone, over the past 2 years has felt isolated and anxious and, concerned about things that they didn't bother them before, but, life got, kind of overturned. Maybe they lost a job or had to change jobs or struggling finding housing or one issue or another impacting them. I mean, how do they work through that? Are there any kind of keys to that? I realize every case is probably different and people are unique, but are there any steps or kind of ways to go about, helping people kind of who, let's say, 4 or 5 years ago would have been thought of as normal, uh, to kind of get back to that point?
So should
Sure.
I address that first? I mean, so you kind of asked two questions. There are
I do that a
heroes.
lot.
Yeah, there are heroes. There are heroes, and I just have to do a shout out right now for the police departments and also the rescue squad, because they have learned how to administer Narcan and they have saved so many lives, and they're going to do it as many times as they need to until that person says, I don't want to do this anymore. I want to get better. And so I have to, really sing their praises. On the other hand, UCS has really tried to be right there. As Alex mentioned, we developed a program called FAST. It opened the door January 3rd of this year. People walk in the door regardless of what their issue is, couples, families. We are right there and we treat them in the moment. And so it has been a wonderful opportunity for people to get referrals where they need to more information. We give little resource bags for people when they leave, so they have apps on how to, how to do self-care, how to meditate. It's a guided imagery kind of things, but also ideas around what does make you happy. Is gardening, reading, do more of those things. Like, we really try to teach how to soothe that nervous system. As Alia said, we are seeing an increase in anxiety. So we are really paying attention in those fast sessions to not only what are their symptoms, but then what are they using that it's alleviating some of that distress. So it's about self-care, walking with your dog. I talked to Alex the other day. He popped in and I was talking to another one of my clinicians. And I said, look, we've been here through the pandemic. We are really joyous. What is it that we're doing? And, all you is with the horses every day, right? And so for me, I walk with my dog every morning and I have a robust spiritual time in the morning, right? For Alex, he really has these different venues that he participates with in the community. So I think it's finding out what your passion is and then doing a lot of it, a lot of self-care, noticing those negative cognitions, right? As Alia said, that when we get depressed and anxious, we start to attach those kind of doom and gloom thoughts. And it's really important that we are proactive with positive affirmations and intentions for the day. For today, I'm going to find peace. I'm going to do things that bring me joy. So I want to hear from others, but that's what comes to my mind.
Though I want to obviously echo everything Lori said, but I want to take a step back, because the one thing that if for folks that are watching is, it's taking that next step, right? For those that maybe haven't sought treatment. And, because I think the one thing that's so, from my perspective, is stigma, whether it's mental health or stigma within those that have a substance use disorder, is one of those key pieces that is a barrier why people don't seek treatment. And so I think once you take that next step of walking through the door,
Yeah.
that will allow us to provide us a plan. Okay, how can we better support you? And when we sit in through these fast sessions, you'll hear folks just and I'll tell you, I was a little nervous coming in, and we'll just we're happy you're here, you're in a safe place. We do the best we can to kind of calm them. But again, it's just taking that courage and that next step to get treatment. So. And then post, and echoing everything Lori just said, we do a really good job of meeting folks where they're at, and really developing a team to support them.
I want to stick with that point you raised, Alex, there just for a second, about stigma, because it surrounds so many things. I heard about it first, mainly in connection with the opioid epidemic, as it used to be referred to pre-COVID, and that people who struggled with that, or alcohol disorder, or anything, were kind of viewed as failures, or some, they perceived that other people saw them as being a failure, and that just sort of seemed to kind of just compound everything. Do you think we're making some progress on that whole stigma question? Do you think that all the conversations that have been held, well, going back at least 10 years or so now, and especially though over the last couple of years during the pandemic, that that whole question around stigma is now much better understood than it used to be? That people sort of say, hey, that could be me. And just because somebody else is struggling with it doesn't mean that they're a bad person in some way or another.
Yeah, I mean, that's a really, really good question, Andrew, to be honest, because stigma is something we talk about a lot. I will say yes, we most certainly have improved. It's something we talk about a lot, not just within UCS, I mean, within the community, right? It's with in partnership with our recovery centers, in partnership with, really anyone that is accessing kind of services within, whether it's harm reduction service, intervention, prevention, anything within that, substance use disorder ecosystem. Because we know from past history that that has been a barrier why folks don't or do not seek treatment. And a perfect example is looking from a local municipality. I will say that I've been so proud of our, more recently, our local municipality and our law enforcement because, 6 years ago, 7 years ago, maybe Lori can, can tell you there was a difference in the perception of substance use disorder and the language that was used, right? And I'll use the example of druggies, right? It's using different terminology, and we've seen a increase of just acceptance. Obviously, we have a lot of work to do. I'm not saying everyone's perfect, but I can say from where I sit, we've seen a huge increase in just of love, compassion, collaboration amongst stakeholders, and I'm really proud to be a part of those discussions. And of course, again, a lot of work to do, but we are making progress.
Yeah.
I just wondered, did any of the rest of you want to chime in on that question before we move on here?
I do, because I think that one of the most harmful things we do between people is put labels on them. And a label is useful for a package for you to know what's inside. So that goes for butter at the supermarket. But it is not helpful to label people categorically because it does not predict what is inside the person, and it doesn't recognize what's inside the person. The best handle we have is using people's names and giving them the respect that they belong with that name, and then giving them the opportunity to describe who they are. And when they have lost themselves, as often happens when it's masked by substance use disorders or by severe mental illness, they are not lost as a person. They are temporarily hidden. And our jobs as professionals is to help them uncover themselves again. But I think you gave the clue to all of our answers in your question, even before the stigma. You said, what are our steps? The fact that you said that we're taking a step, the fact that we asked at people to come in a door, the fact that Lori described 4 or 5 different ways that the 3 of us personally take steps to keep ourselves going. It's the engagement in continuing till the next minute, the next hour, the next afternoon, the next day that carries you forward and builds the connection to move forward. The place where stigma is so damaging is it creates literal concrete brick walls in communication because it sets up an impenetrable barrier by using a label. And the whole point of decreasing stigma is not to find a new name. It's to find a way not to use that to determine how we interact with each other. And Alex highlighted the change in the Burlington Police Department and our collaboration with both them and Vermont State Police and the Manchester Police Department. It's made a huge difference, and they're actively working to make a huge difference in the community. they admit it's not a one and done. It's a constant daily effort. And the same thing has to be true of all of us in the community. It has to be a constant daily effort.
I know that we're running out of time here, or our time is coming to a close, but I just wanted to throw or ask about one other area here, and I see that you're going to be hosting an event around this next week at Lake Perrin on September 8th, the next Thursday. And that's the whole very sad and tragic question around suicide. Have we seen more people either threatening to take their own lives one way or another, or is that trend line beginning to stabilize in some way or another, or how are the numbers increasing, or what is our status like at this point on that?
Lori has spearheaded our effort, so let's have her go.
Well,
Over to
and
you, Lori.
also, and yeah, so we actually have two events coming up that I think it's really important that we have community response to. So it's an open invitation, September 8th at Lake Perrin in North Bennington. We will have a suicide vigil, so that will be at 6:45 p.m. We will have lanterns that we'll be giving out. We have invited community partners to feel free to set up a table. We do have a speaker on the subject, and although I hope other people show up and share words of wisdom with other people that are suffering right now. And also on September 21st at Old Castle Theater from 6:30 to 8:30, we will have the Vermont Made film on, I believe it's if anybody can help me with this one.
Heart?
Yes. And we will have a panel discussion afterwards. And so that is also an open invitation for the community to participate in.
One of the worst things that people do is not talk about the person who committed suicide with all of the people who survived. It becomes something like, oh gosh, something we can't talk about. That's another stigma. And actually being willing to sit with somebody, whether the person is sad, is paralyzed with sadness, or is angry, or feels just gypped. There are so many different gamuts of feelings in response to somebody committing suicide. The worst is to pretend it didn't exist and try to sweep it under the rug. In general, when we have painful things, trying to pretend that they are not there creates a ghost or a bigger problem that balloons over time. And so creating acceptable dialogue that we shoulder burdens together as a community and move forward is some of the most healthy things we can do. And that's part of the purpose of this vigil next week, is to give just one moment. It doesn't take it away from every day, but it's one public moment of sharing the burden together.
Okay, well, I guess I wanted to leave this on a sort of on a hopeful note here. If someone is aware of a neighbor or a family member or someone who seems to be struggling above and beyond, what they can reach out to you folks at UCS, just a phone call, or what's the best way for someone to get in touch with one of you or your services?
So our number
802-442
two
5491.
Okay. Well, it's certainly extremely important work all of you are doing as we've gone through a very unusual, well, hopefully it's an unusual past couple of years, and that hopefully maybe sort of kind of that is beginning to finally, or at least shall we say we're closer to the end than we are to the beginning. I don't know. Every time I think, oh, well, the pandemic's over now, then it turns out we have another variant that comes along that changes that. Okay, well, I guess just before we do go, was there anything else that we didn't touch upon that you felt we needed to say something about, or there's some resource out there that people should be aware of?
I think the one resource that I think it's worth mentioning is it's a new suicide hotline. It's called 988. And actually, I think I have.
So it's a national number that then links you to local
Thought I had it.
services. Here you go. You have it?
I thought I had it, but I can't. It's not.
All right.
I think I put them all in the harm reduction bags.
Oh, okay. And that's the other thing. People who come to UCS are welcome to walk away with a harm reduction bag that Lori and her team have put together that include a list of resources and include samples of Narcan. And they're simple, lightweight, little ditty bags with shoulder straps that anybody can walk around. And we're trying to get them distributed in the community as far and wide as we possibly can. Because everything we do requires starting again. Yes, there's the ditty bag.
819 bags have been delivered in our community.
From just UCS. Just UCS.
Oh,
Just yes, and just this past year.
that's impressive. Oh. Well, I guess we'll have to leave it there for today. I want to thank you all very much for making the time for this conversation. I was thinking as we were talking there about isolation that maybe the next time we have one of these conversations, we can actually do it in person in a studio somewhere as opposed to on Zoom. That would be kind of that'd be sending a message, right? Anyway, well, we'll see. We can hope for that. But for now,
We
we'll
hope
leave
you
it.
come to our events too.
Okay, yeah. All right, you're on. Well, we'll have to leave it there for today, folks, but hope you found our program interesting and worth watching. And again, thanks to Lori Vatican, the Director of Outpatient Mental Health and Substance Abuse Services, Alex Figueroa, Assistant Director of Substance Use Disorder, and Alia Reeve, a Medical Director at the United Counseling Service, all at the United Counseling Service in Bennington, and also an office in Manchester. So thanks again. Thank you for being with us. Thank you to our three panelists for making the time for this conversation. And well, if you need help, you know where to go now. So
Thank you
thanks.
very much, Andrew, and
Thank you, Andrew.
take care, everybody.
Okay. Have a good day, everyone.